Good morning, everyone. You are listening to Morning Sign-In on UCLA Radio, and today you are joined here with Laura and
Nicole.
It's very nice to be with you this morning. So today's topic is non-disjunction. So if you've ever heard terms like Down syndrome, genetic screening, or even wondered why miscarriages are so common but rarely talked about, that's what we're here to talk about today and learn about the cell division that happens.
Yes.
So what is non-disjunction?
Non-disjunction is basically a cellular glitch that happens during cell division. So normally when cells divide to create eggs or sperm, which is a process called meiosis, the chromosomes are supposed to split perfectly in half. Each cell should get exactly one copy of every chromosome, clean, organized, and balanced, but sometimes that doesn't happen. So non-disjunction occurs when chromosomes fail to separate properly. So instead of splitting evenly, one cell may end up with too many or too little chromosomes. So that can have real bad effects later if you have too extra or too little.
So they just rearrange them, or they're supposed to split evenly, but sometimes they don't. And this is it's like card dealing almost, right? Everyone's supposed to get one card, but some get two and others get none.
Yeah.
Wow. Okay, so what is normal meiosis, I guess, supposed to look like then?
So during normal meiosis, there are two main stages. Meiosis 1, where matching chromosome pairs, one from each parent, they're supposed to separate. And meiosis 2, where the identical copies called sister chromatids are supposed to split apart.
Okay, and so meiosis 1 leads into meiosis 2, right?
Yes.
Okay, just to I guess reframe for everyone that hasn't taken biology since in years, I guess. So meiosis 1 is where you have pairs of chromosomes, right? And
Yes.
Those pairs aren't supposed to split up. Or at the end they do? Wait.
Okay. Normal meiosis.
So they don't separate in that first stage, but then the second stage, the copies don't separate. So these pairs become copies.
I don't think so.
No? Okay.
Oh wait, I think you are correct.
Okay. We can look into that and fact check ourselves real quick. But so I guess what exactly causes these breaks in chromosomes to happen, the pairs?
So non-disjunction can happen in either stage. So if the chromosomes don't separate during meiosis 1 or 2, they might end up in the wrong. They might end up with the wrong number of chromosomes. So it can even occur in mitosis, which is the division of regular body cells. So
Oh, when does that happen?
It's meiosis 1, meiosis 2, and then mitosis. I'm pretty sure.
Oh, they each lead into?
Yeah, they each lead into each other
Okay.
for cell production.
I think so. Is that it? Okay.
Producing of sex cells.
Right.
Or gametes.
Okay, so it's if you have an oocyte or a sperm cell, then they each have their own
Cell cycles.
Yes. Okay.
Okay. One of the major reasons why non-disjunction can happen is something with the spindle fibers. So they're the microscopic ropes that pull chromosomes apart during the division. So when they don't work properly, the separation fails. So this risk can... Oh my God, sorry.
No, you're good.
The risk of this happening can increase with age, specifically the age of the biological mother.
Oh, so I guess that's why people are always talking about you're reaching that age.
Yeah.
You gotta have kids soon.
Yeah.
That's kind of scary.
You're more predisposed to it as you get older.
Oh, okay. Interesting. And why does that happen? Is it just time?
Yeah.
Huh. Okay, well, that's super interesting. I didn't know that.
As you get older, stuff in your body starts getting more wonky, and stress can take a toll. All outside factors. As you get older, you're more predisposed to cancer. So just things like that.
Yeah, I wonder, do sperm cells do the same thing or no?
No, I don't think so.
Huh. Okay.
As you get older, the sperm can get more stagnant and not move as fast and swim as fast up. So I guess it's more both of the same, but I think it's more predisposed to happen in women other than men.
Okay. Interesting. So something could be wrong, but even before the sperm and oocyte meet each other.
Yeah.
Yeah. So I guess like, so an individual like the woman, I guess, could have 3 copies of chromosome 21.
Mm-hmm.
And so that is that cell or chromosome?
Chromosomes.
Those chromosomes are already predisposed to have an extra 21.
Yes.
Okay,
Yes.
okay, I see.
And I think what you're talking about, the
Mm-hmm.
chromosomal, I don't want to say deficiency, but
Mm-hmm.
the result of that is Down syndrome, which you see a
Right.
lot in people.
Mm-hmm.
Yes.
Okay, I see. So this ends up, so how is this like improved? Like, are there already specific measures like to know about this in the what is it called? Like preemptively?
Yeah, you can go to a genetic counselor
Okay.
and you can see if your family's like predisposed to anything. Like sometimes recessive genes might come out, which is why you might have like your mom and dad might have brown eyes and you have blue eyes because someone in your past lineage might have carried that gene to have like blue eyes.
Interesting.
Yeah. But you can go to a genetic counselor, take prenatal vitamins, and just honestly go to the doctor.
Yeah.
And
That's got to be a big thing.
I guess don't wait too long to have kids because your
Mm.
body starts to go into like menopause at a certain age.
When is that? Is that like 50? Like,
I think it's like between the 50-60 range, but
Oh,
like it
okay.
depends on like the person. But I guess.
interesting. Wow. And do these like genetic counselors, like they just need like a swab of your like spit or something and they can just trace back your lineage, or like how does it work?
I think with the genetic counselor, you do like blood tests, spit
Okay.
tests, and things of that sort.
Okay. Interesting. That's like so crazy to me that they can like track so far back into your lineage and see like what genes like everyone has.
Yeah.
So is Down syndrome the most common result of non-destruction, or
Yes.
okay.
Down syndrome is the most common.
Really?
Yes.
Is 21 just like a more, I don't know, like there's more 21 chromosomes out there to go around, or like like how does it
I guess so. I think that's just like the weakest gene.
Okay.
And that's the most common that a lot of
Mhm.
people might have. So maybe a lot of people's family lineage has came from like Down syndrome.
Mhm.
So that's what I'm assuming.
Okay, interesting. Sweet. Let's see. Should we take a music break and then come back with the next segment?
Yes.
All right, sweet. Come back or listen to some, what are we listening to next? Simon and Garfunkel. I love Simon and Garfunkel. But next we'll be talking about real-world examples. Hi everyone, we're back here to talk about real-world examples with non-disjunction. So, I guess what are some of these X chromosome disorders that we can see?
So we can see Klinefelter syndrome, where a male is born with an extra X chromosome, so it's XXY, and Turner syndrome, when a female is born with only one X chromosome instead of 2. So that can lead to like physical abnormalities and not fully developing certain body parts and not going through puberty fully.
Oh, interesting. What kind of like physical abnormalities do they go through?
They can go to having like, I think, like, let me.
Okay, no worries. I think this is like so interesting because I feel like a lot of these, I guess, different categories of disorders go unnoticed for such a long time. Like you might not even know that you have an extra chromosome in one case or another.
True. I definitely feel like it's the way your body presents it because certain
Mhm.
people with certain chromosomal differences, they do have similar facial features. But like, say, someone with Turner syndrome, I want to say that you can tell. Maybe not outside looking in, you can tell, but you definitely would think it was like a child because some of the effects of having that one chromosome instead of 2, you can have like hypothyroidism, a wider chest, low set ears, small jawbones, like swollen hands and feet, and like moles, and you can be infertile. Also, short stature is a side effect, so you will look like a child if you do have this chromosomal difference. So I feel like
Just
that's
like
when you can
forever?
tell. Yeah,
Oh,
yeah.
huh, interesting. I guess there are some more like dramatic syndromes, but I feel like the other one with I feel like I've heard about the male with an extra X chromosome before. Like they
Mhm.
just I remember it was mentioned in my class in like high school, and it sounded like something they might not even realize they had. But
Some of the differences with that, I feel like they would be able to notice because they
Mhm.
have enlarged breast tissue and increased belly fat, but also that can be like.
Yeah, I was like, I don't know, like, I feel like I wouldn't know the difference. I'd be like, man, I just need to cut back, like, you know, like.
True. But they also are sterile, so like no procreation.
Okay.
They also have a taller stature and small penis and testes and psychomotor delays and learning
Psychomotor delays.
Yeah,
like
a learning disability.
I see.
Like cognitive impairment.
I see. So I guess there are some factors that might raise flags for having these different things.
Yes.
Interesting. So do doctors, I guess, like test for these as well, like with different, like these count as diagnoses, right? Like medical diagnoses.
Yeah. You can try to like, I guess, preemptively do this by like doing pregnancy screenings. So like non-invasive prenatal testing. So you can see the genetic health of your fetus through a simple blood test from the pregnant parent. So it's like not invasive, like they're sticking a tube or like a camera up anywhere. Or you can do miscarriage research because nondisjunction is like the leading cause in early pregnancy loss. So learning more about nondisjunction and why it occurs can like be very helpful to those people who like might not know why they like had a miscarriage.
Yeah, I think that's definitely a very emotional issue because I think it means a lot to kind of understand that these miscarriages might be because something wasn't biologically right from the very start, you know, like before the sperm and the egg even meet each other, it was already off. And so I feel like it becomes a very emotional issue to have a miscarriage. So I think understanding why that happens means a lot. And I guess with like routine screenings, it's important to know that there's I think it's important to kind of like frame these problems not as like a tragedy specifically. And like, because there's a lot of support out there. Like I feel like a lot of people with Down syndrome are going to college and like living really full lives. And it's because of these like medical supports that they get from an early age and like getting like speech therapy physical therapy and like occupational therapy, all sorts of therapy. But a lot of people with these imbalances of chromosomes still have really full lives, which I think is great. But I think it does become a question, like, when you get these screenings and if you notice something is off, like, does it become too much information? Like, is that, like, us, like, kind of being invasive?
For me personally, I feel like no. I feel like if you are bringing a child into this world, you should want to do, like, your best at seeing, like, if they might need any extra support needs, if you can meet those needs, because some women are not able to meet those needs and they don't have the resources or are able to, like, help a child and fully support themselves and their child who might have Down syndrome or, like, many other severe cases of any non-disjunction occurring. So I definitely feel like it isn't too much information. It might be too much information if it's not conveyed right or if it's putting something onto the mother, like, oh, something's wrong with you, like, this is your fault, when it's really not anyone's fault. It's just, like, yourselves are messing up. Like, you can't control that.
Yeah, definitely. I think it would be good information to have, especially to, I guess, prepare. Like, I feel like before giving birth, like, you maybe want to know if there is something wrong, like, if there would be extra support needed so you can, like, prepare to, I guess, have this support on hand when needed. Let's see. So, interesting. I'm seeing, like, Klinefelter syndrome. Is that the extra X chromosome? Okay, I see. Yeah, support, like, it's not, I think it's also important, like, it isn't, like, fixing someone. It's very important, like, how we talk about this is very important because we're not saying, like, nothing is wrong with someone with, like, an imbalance of chromosomes.
No, nothing's wrong with that.
Exactly.
They just might need more support. And some people don't need more support. They are fully able-bodied. They just look different on the outside, and people might treat them different or infantilize them because they think that they have those things going on when they don't, when they're fully able-bodied.
Yeah, and I think it's very important, too, because when it comes to researching this kind of stuff, it becomes a heavy topic because people look at it from these different perspectives.
That's true.
So I think it's very important to talk about, like, these sort of ethical questions that go into pre-screening and what might cause these imbalances in the first place. Just to spread awareness and, like, just have people know, like, this is how it starts. And man, like, the miscarriages, I think that hits really hard for a lot of people because a lot of people go through miscarriages, and that's an extremely just, like, emotional thing to go through. So just, I think knowing that it isn't the woman's fault. Like,
It's no one's fault.
Yeah, it's no one's fault, like, ever. I see, like, there's a lot of educational programs for, like, people with Down syndromes that have been put into place, at least in the United States. So U.S. public school students with chromosomal conditions, they already, like, get accommodations, like, just straight going in, which I think is great. Like,
yeah, it's great.
Yeah, so having that support is very important, and I think it makes quality of life a lot better.
Extremely better, because I feel like beforehand, before we knew, like, all this stuff about Down syndrome specifically, they used to, like, lock kids in a upper attic to, like, keep them away from the other family members and stuff like that. And I feel like a lot of people have this conversation, like, oh, like, people are just now having Down syndrome and all these genetic differences are occurring. And I'm like, no, they used to, like, lock, beat, or kill people who are not able-bodied.
Yeah.
So of course we're seeing a, like, spike or more people with those different type of disabilities because they're not dead and they're allowed to, like, come outside and interact with everyone else.
That is definitely very true. I think as society, like, gets more integrated and diverse, like, that's something I've noticed a lot as well, like, with stuff like autoimmune diseases. Like, people are just being diagnosed a lot more and, like, treated a lot more, whereas before, like, no one really knew what the treatment was, and so it would just become a question of, like, oh, like, you're just, like, bedridden, like, all day, and that's so bad. But I guess, what do you think actually, like, shapes quality of life? Like, do you think these supports are enough to uplift the quality of life, or do you think, like, the imbalance of chromosomes kind of takes over?
I definitely feel like it's case by case on how severe it is, because I know a lot of people, like, with certain, like, disabilities and chromosomal disabilities, it's like a spectrum. So I definitely feel like it definitely depends. For some, the support might be enough, but for others, it might not be enough, because someone with the more severe case of Down syndrome might need, like, a caretaker 24/7, and that's really expensive. So what if someone from a lower socioeconomical status doesn't have access to those resources, or, like, the waiting list is really long or something like that? So I definitely feel like it's definitely case by case, but overall I do feel like those resources are helpful, and, like, obviously they can be, like, more improved, but you have to start from some point. So I feel like having those in place definitely can help people.
Yeah, definitely. I think, like, the school accommodations is definitely a good place to start, like, just for, like, everyone, like, no questions asked. That is an accommodation that you get. But I feel you, like, it does sound expensive to have to deal with this from, you know, the start.
Yeah.
And, like, medicine is so expensive.
The doctors
Healthcare
is so expensive.
So expensive. It is definitely a very big obstacle to have to deal with in your life.
Yeah.
But I think definitely what you said, case by case, like, I think these support systems do help a lot, and it's really great that we have these support systems. I think it becomes an issue of making them more accessible to people. So what do you think is something that, like, maybe the public might get, like, wrong about these chromosome imbalances? Like, do you think, I feel like I don't hear about it as much as I used to.
Definitely feel like something that they get wrong is, like, assuming that something is, like, wrong with the person because they have that. Because, like I said, you can be fully able-bodied and just look different. And I also feel like they put a lot of blame on the mother when it's not her fault.
Yeah.
Or, like, a lot of external factors when it's not really anyone's fault. Like, you can be predisposed to these things happening, and it's not your fault because you can't control your genetics.
Yeah, definitely true. I think
I also do feel like the public thinks that there's, like, good genes. Like, good, like, genes that are better than other people's just because how it presents yourself, how it presents, like, either skin color, everything. So I definitely feel like that is an important topic.
Yeah, did you see that commercial with Sydney Sweeney? Oh my gosh. I definitely think that is something that we're seeing a lot these days, and it's important to address because no genes are better than others. That's
Exactly.
yeah, what? This kind of goes back to our first week when we talked about CRISPR and kind of like editing genes. And I think it is a question with this pre-screening. Like, is it that we are kind of seeing if these chromosomes are good enough? Like, are we kind of trying to pick and choose
Yeah.
who we bring into this world? Like, that's like crazy to say
Even
and
with
think about.
even with that, like even if you do genetic testing, all those preemptive measures, you can
Mhm.
still have it occur without
Yeah.
the doctor or anyone knowing. So even if you don't want to have a baby with a disability, you might still have a baby with a disability because you just
Mhm.
like never know. Of course, like modern medicine is very nice, but they can't predict every single thing that's going to happen.
That's
Because like
true.
stress can also take a factor. A lot of other things are factors as well.
That is true. But I feel like, I guess, hypothetically, like if medical technology were to, be able to see everything
Mhm.
about the chromosome, like, do you think that is, like, too far for us to, like, for if a parent really just wants to know, like, oh, like, what, I don't know, what are these, what's it called, like, little embryos looking like? And goes to like pay a doctor a bunch of money and is like, tell me everything about this, and they're able to tell like everything, and they can kind of be like, oh, like, you want to keep it? Like, that's like, it's a crazy question to think about, like, that you can kind of preemptively see your future.
That is true. And I feel like if that were to happen, I feel like there will be ethics in place to make sure that you're not just like, I'm going to say, aborting your baby because it has like a disability.
Yeah,
I definitely feel like if that were the case, there would be, yeah, ethics in place to make sure that doesn't happen.
that is true. I wonder like what kind of policies those would be though. Like,
Or like not telling the mother fully.
I feel like that's also like a questionable thing. Like, if you're
True.
like a medical doctor and like your job is to provide these tests, for you to be like, oh, like there is something I can't tell you. Like,
I don't know.
I don't know. It is a weird question to think about. Um, so I guess going back to pre-screening, I was thinking more like do what does this pre-screening not tell you, I guess, about these chromosomal differences? Like, I feel like it can tell you when there is an imbalance, but doesn't tell you how severe that might be.
That's true. It can't tell you if they'll show the symptoms
Mhm.
or if they do, how like their body will react, how their body will react to certain medications, if that is placed, how they might act mentally, because you can physically have a
Mhm.
disability but not mentally. It also can't tell you if the disease will progress or like sort of hash itself out on its own.
Really. I wonder, like, are there any tests that can be done to, I guess, see how severe it is? Or
I don't
is that
think
still,
so.
like, developing?
I think it's still developing.
Okay, interesting. Yeah, so even if you get these pre-screenings done and you find out there's an imbalance, it's not the full story. And I feel
Oh,
like there's a lot of factors that play into it, like your family and, like, where you grow up, access to support, definitely a lot of things, I guess, outside of just how the disease is presented.
yeah.
Or I guess, I don't know, I don't think disease is the right word. How the imbalance is presented in the
Yeah.
person.
And also like a negative test result might not really be negative. It might actually be positive.
Mhm.
Like you can't really tell. It's not like 100% there.
That is true, I guess, with like any medical test that's being done, there is what's it called? Like
Uncertainty.
yeah, an uncertainty, that's the word. Statistics. But yeah, I think it's important to say that like people with these chromosomal differences, like two people can have the same chromosomal imbalance and have totally different lives.
Yeah.
So you never really know what you're going to get. And I feel like that's the same for like everyone being born. Like you
Mhm.
never know what's going to happen. Like everyone goes through different experiences, and I guess this is just a different version of that.
Yeah.
So I guess like why is quality of life such a hard thing to predict?
I mean, I guess you can bring up the topic of like nature versus nurture. Like,
Mhm. That is true. Like, does your environment probably plays a big factor into it, like how things develop.
Like if you have like a more supportive environment, not supportive environment, access to resources, not access to resources, if your parents are shunning you or resenting you for having a certain disabilities versus if your parents love you, nurture you, pour into you. Definitely feel like that can play out because a lot of people with these chromosomal differences might feel infantilized, like they can't take charge and do their own thing, like they don't have their own thoughts. So I definitely feel like that plays a big role into it.
Yeah, definitely. I think a lot of it is support early on, and I guess how your environment responds to you having this imbalance, if it does affect you in the first place. Yeah, I can definitely see that really affecting a person, and I feel like it can affect anyone. Anyone that grows up in these different circumstances can end up developing different disorders. And I don't think that's any different in this case. I think they're probably a little more, I guess, at risk for developing these, right? Because I feel like it takes a mental toll to have to deal with this.
Yeah, I know it can also lead to like more issues like mental illness down the line. Because ableism is very prominent in some communities. It's very ingrained into our society.
That is true. I guess, what do you think is something that society can do to, I guess, kind of start to undo this ableism? Like, what is the best way to frame these chromosomal imbalances and disorders that people have in a more, I guess, accepting and integrative way?
I guess first off is don't use like people's disabilities as the butt of your joke. Like, don't make fun of or mock someone who's different because, like, that can easily be you, if not, like, everyone is prone to be, like, I guess, quote-unquote, disabled. So I guess, like, don't mock and just, like, try to think of things from a different perspective because a lot of people think of things only from their perspective and they can't fathom putting themselves into other people's shoes. So I guess just try to put themselves into other people's shoes and see how, like, that might make them feel when you say those things or have these preconceived notations about certain groups of people that might have a disability.
No, definitely. And I think, like, learning about what might cause these also makes a big difference because I feel like a lot of ableism stems from kind of thinking something's wrong with a person.
Yeah, nothing's wrong.
Yeah, and so I guess kind of educating people and showing that this is kind of something that happens even before, like, what's it called, like conception, like when the two eggs meet, egg and sperm. Before that even happens, like, it's nothing to do with the person itself or any person, really.
Yeah.
And it's just, like, purely biological. I think learning that and implementing that more into, like, our education from an early stage probably is very good. I don't know if, I feel like, did your elementary school have any classes like that, like, teaching about disabilities or...
No, we just went through it like normal, I guess. We never really talked about, like, disabilities and how they happen. I just thought, like, I was just like, oh, you were just, like, born that way.
Yeah.
But I never treated anyone differently because they were disabled. Like, all the same.
Yeah, no, exactly. I think that's what matters. I think they promoted a lot more, like, we're all the same. Like, don't bully, stuff like that. I think that was very frowned upon, like, so I think that's good. Like, even if there wasn't, like, I think we were a little too young probably to understand anyways, so I guess maybe that's more of a middle school / high school thing. But I guess, like, what do you think, like, I don't know, I think if you could, I guess, find that, like, goes back to the same question, like, if you know the severity of something, then you can, I guess, prepare better.
Yeah, because sometimes the quality of life for the child might not be the best, or they might be, like, fully immobile, and, like, do you want that for your child? Think about, like, all the costs, because, like, the doctors isn't free.
Yeah, definitely. So I guess, like, to simplify everything in, like, terms, like, when you get a pre-screening done and you see that diagnosis on paper, like, what context is missing from that? It's, like...
The development,
like, how it shows up.
The uncertainty, like, almost everything.
Yeah, that is true. Like, how would parents deal with that uncertainty then? Like, I guess just learn about what could happen, worst case scenario.
Yeah.
Yeah.
Because I know, like, a lot of people just love their child no matter what.
Yeah.
So I definitely feel like if they know beforehand, they can get more resources, they can be ready for some of the like barriers that their child and them are gonna have to cross, and just like see like the laws for disability,
Yeah.
see if any schools can like support them, stuff like that.
Yeah, definitely. And I feel like diagnoses, like, they're not like a specific like roadmap to like
no.
how to like raise your kid or anything like that. But I think it can be, it's a good thing to maybe prepare for just in case things.
Yes.
Yeah. But I think, let's see, the future like isn't static. Also, like, when we think about these things, like, we're thinking medicine right now.
Yeah.
Whereas we don't know what's going to develop, say, like, in like 10
future.
years.
Yeah.
Like, medicine is constantly changing. Like, this is a frontier that's just constantly going through renovations and, like, coming out with new things and new cures and new, like, treatments. So right now when we think about these genetic disorders that come out, we might not have as much technology right now, but I feel like this field is like so rapidly changing. That could change so
in
fast.
an instant.
Yeah, definitely. Like, even with like CRISPR, like, I feel like that technology, like, I didn't know like that it's being used for diseases like sickle cell disease. Like, it just always kind of seemed like this futuristic kind of thing. So you never really know what treatments are going to come out and get approved to help, and like what different support systems might come out medically either.
That is true. The future is uncertain.
Definitely very uncertain. It could be so different. Like, I feel like, I mean, even just recently, like, in the past few decades, I feel like treatment has changed a lot for these, right?
Definitely.
Yeah.
Yes.
Like, and it's even, like, culturally, like, going from, like you said, like, keeping them in an attic to integrating them into society, I think that makes a huge, like, at least mental difference.
Yeah.
And that probably definitely improves quality of life drastically. So I think it's important that families don't base decisions on like outdated information and assumptions. Yeah, but I mean, I think it is a question, like, are we able to talk about like a future that medicine hasn't caught up to yet?
Yeah.
So I think it's definitely something to consider, and maybe look into technologies that are developing. Like, I feel like if I were a parent and like I found out, I'd be looking into like, oh, like what research is being done right now, like what's happening, like what's the future looking like. But yeah, definitely all very interesting things to think about. So like, identity does not equal diagnosis. You no matter what your chromosomal makeup looks like, you are a person,
Yes, we're all the same.
Yeah, and so I guess coming to a conclusion of today's radio show, non-disjunction can happen in either meiosis 1, meiosis 2,
and
mitosis. And this is when the cards don't get dealt right.
Yes.
Yes.
Can you either end up with too many, too less, or not any at all?
Right, and this leads to different disorders, such as Down syndrome, Turner syndrome, which can affect quality of life or can go unnoticed for many years.
True.
And so this is very interesting to think about with pre-screening, and it's a leading cause for miscarriages. All very important things to talk about.
Yes.
So we hope you learned as much as we did this morning, and we hope that you have an amazing rest of your day. Thank you for tuning in. Be back next Tuesday, 9 a.m. for our next show.
Bye.
Bye. Thank you.